Good afternoon, everyone. The Chief Minister offers his apologies for this afternoon's briefing. He's got a telephone conference call with the UK Government that starts at 4:15, so unfortunately he's stuck with me today. Before we move into the main part of the briefing, I just want to give you an update on the figures. So the total number of tests undertaken is 1,638. Of those, we have 155 tests back. Total confirmed cases of 139 now, and we're awaiting results back from 183 tests. From today as well, I can also give you the figure of those who are presumed to be recovered, and that figure is 55, so that means that we have 83 active current cases on the island. Turning now to the main part of today's briefing. On the 25th of March 2020, the Council of Ministers closed the Isle of Man's borders. This came into effect on Friday the 27th of March. As well as closing the borders, we shut non-essential retail premises, closed bars, restaurants, and imposed stringent self-isolation and social distancing rules. We did all of this for one reason: to save lives. And the preservation of life has been the objective behind every decision that we have made, continue to make, and will continue to make in the future. We have taken critical decisions to prevent our NHS being overwhelmed and to protect the most vulnerable in our society. We continue to do so based on the very best advice available to us from our clinicians. It is with that advice in mind that I am able to make this announcement today. Closing the borders, knowing that not all of our residents would make it back, was an extremely difficult decision. We have now been contacted by over 190 people in the UK and around the world who have asked to come home. We have been working since the border closure with our clinicians to develop a process where we can manage the return of our residents to the island clinically safely whilst balancing the need to preserve life and protect our community. In line with our clinicians' advice, from the 15th of April, Isle of Man residents will be able to travel back to the Isle of Man on designated sailings of the Ben Macrae, but they will be subject to a mandatory 14-day quarantine on arrival on the island. This will be done via an application process. It is not a free-for-all. A particular slot will be given to those wishing to travel back in such a way. You will only be allowed to travel back to the Isle of Man if you are not showing any symptoms of coronavirus. Health checks will take place before anyone travels back to the island. Suitable secure accommodation will be provided for those returning during this period. They will not be going back to their own homes or into the community. Strict social distancing will be enforced at the accommodation provided. People will be required to stay in their rooms, but there will be access to an outside space for a brief period of exercise each day. No visitors will be allowed. Further information regarding the application process will be released over the next week. What is critical is that we manage this process in an orderly fashion. So I need to make clear that if you are a Manx resident in the UK or overseas and you want to return to the island, we need to understand your exact circumstances so we can manage your return back to the island. If you have already contacted us, we will be in touch with you directly. If you have not been in touch, you need to contact us, and that can be done via emailing returningresidents.co@gov.im. So that email address again, returningresidents.co@gov.im. For Manx residents outside of the UK, you need to return to the UK on any commercial flight you can. This may mean routing through a different country. You need to make sure you look at all your options. If there are no commercial flights available, then please follow the UK Government's instructions from the Foreign and Commonwealth Office to check eligibility for repatriation flights. In the past week, the UK Government has flown around about 1,500 people back to the UK, but their full plan will take some time to get people back from countries across the world. Everyone's individual circumstances will be different, and it will be impossible to plan for each individual scenario. that all those scattered around the world may face. You may require support, and our team will do our best to help you. But I must be clear, this is not a short process. We will bring people home, but this will be in an orderly, managed manner at a time that is right for the Isle of Man. This approach is tough, but it protects our community and will preserve life, while also doing the right thing for those that may, through no fault of their own, have been caught abroad. We will be keeping this under continuous review, and if there is any indication that this is impacting our ability to manage the virus on the Isle of Man, then it will be ceased. I have previously described what we are facing as being a war with an enemy that we cannot see. There will be many of us who are looking forward to spending the long Easter weekend with friends and family. This year, though, we must stay inside. If we can, though, let's use our technology to keep those relationships. Phone a relative, WhatsApp a forgotten friend, Skype a neighbour. And now I want to turn to today's shout-outs. Firstly, Isle of Man railway workers who have been redeployed as security staff and are currently manning the door at the Nobles Hospital. Thank you for the work that you're doing. To Stan and Pam Clucas of Balafesson, who are all allowing people passing by on their daily walk to pick daffodils from their orchard in return for a smile. Thank you. And to Simon Fenton at number 16 Victoria Street, delivering Manx meats to those who may be vulnerable and self-isolating. Thank you. And as Minister for Health and Social Care, I would like to add a personal thank you to all those in the primary care environment. Sometimes primary care can be the forgotten part of health and social care. From our GPs, who are our frontline workers, really at the front end of this, down to the people who are manning our emergency dental service, which still has to operate on a daily basis for those emergencies that we may still experience. Thank you very much for all that you're doing, and it really, really is appreciated. There have been tough decisions that have had to be made. There will be more tough decisions, I am sure, to come. But together as a nation, as one community, we can win this war. Please continue to help us to do so and stay at home. And I will now take questions from the media, turning first of all and to Manx Radio and Tim Glover. Tim?
Last to my Minister. Great that we've now got some of the people that have recovered. I think we've been asked that more than anything else in recent days. People, I think, are just wanting to hear some good news in amongst all that's going on. I'm just wondering if you've seen the Guernsey government website where they detail hospital cases, how many are in a critical condition. It's the demographics, it's how many recovered, the contact tracing, and indeed an estimate of how many is self-isolating, and even has clusters. Those are the questions that we keep revisiting, I know, but the ones that our listeners keep asking. So how many people recovered? We've covered that, but where are the cases on the island? How many are linked? And what's the age spread? And could we install something like Guernsey's website, where it's very detailed and a good website?
We're already looking at the way we report things online, but in terms of our cluster reporting, and I think I answered this at Thursday's briefing, we can do it by postcode, but it's only the first 3 letters of postcode we can use, because otherwise you're reporting too low down and you'd be reporting at basically a street level. So the cluster at the moment is showing around IM2, but as I think I mentioned at Thursday, that is not a surprise because the IM2 postcode is one of the most urban postcodes on the island. At the moment, there is a spread based. The spread seems to be based on the volume of population. So it's right across the island. There's no what would be defined as a public health cluster point being identified at the moment. But we are looking at all the different mechanisms as to how we report and what we can feed on a daily basis. What we need to make absolutely sure, though, is that any reporting we do is easy to pull together and easy to be reported on. Because what I don't want to be happening is that we end up with public health officials pulling together a whole load of data to put it public and moving them away from the day-to-day job of managing the virus, contact tracing, etc. So we are looking at what our reporting structures are, but anything we report on will be stuff that we can pull the figures together without a huge amount of work to do so.
Sorry, I asked as well, how many are linked and the age spread? Are we able to give the details on that?
Right, in terms of the age spread, we are still seeing a very younger age group. We wouldn't be able to do it in minute detail. Again, we would have to report by age bracket on that. So we are still seeing a younger spread. So we're still seeing the majority of cases between the age of 18 and 34. We're not seeing a very large spread in the older age range. We have very few over the age of 65 at the moment, but that could change. But obviously, we again pulling that information together on a daily basis. It depends how much work is involved in public health doing that, because in terms of people being told to self-isolate via 111, I believe we don't capture that information. So that would be something that would have to be a new line of reporting for public health to do. And at the moment, with them clearly being under the pump, because we are still continuing community testing and community tracing, I'm reluctant to pull them away to be doing a load of statistical work when they should be focusing on the challenge of fighting the virus on the ground.
Can I ask about the number of hospital admissions that we've got? I think it was at 6 this morning.
It still is.
Is that still the case? So how many patients can be accommodated in wards 1 and 2? And how many are there? Is it just the 6? Because we are getting reports that those wards are pretty full.
Right, I can give you those figures. So the 6 that we report on, they are people who have a confirmed diagnosis. So they are people who've had test results back and they are confirmed as COVID patients. In terms of the hospital awaiting results, we have 16 people. So we have 16 people who are in the hospital but have not yet had a confirmed diagnosis of COVID-19. Okay, next up we have Rob from 3FM.
Good afternoon, Mister. I just wanted to ask first off about the repatriation process that you've mentioned there. You said that it will be staggered, it will take time. What sort of timescale are you looking at? I know it will vary depending on where people are in the world geographically, but how long could people be expected to wait?
Current estimates with the number of people we know that are abroad range from possibly 5 to 8 weeks. We have to do it in a controlled manner, so it won't be a free-for-all. It won't be people just allowed onto the boat to wander around. We will need to mainly use the cabins to separate the crew away from the passengers coming back. We're doing it all in conjunction with our clinicians to make sure that we're doing it in a medically controlled manner, and obviously what they say will guide our decisions as to how we do that. So we expect that the numbers per sailing will obviously be limited. And obviously we need to put them up in suitable, secure accommodation over here upon their arrival as well. So those demands will actually dictate how many can be done at any one time. So the important thing at the moment is that people who are wishing to return to the island do get in touch with us via the email address I've already given, so that we know their situation and we can look to bring them back in a controlled manner.
Thank you. And my second question leads on from that, really. If we're looking at a 5-week to 8-week waiting time to be getting back, 8 weeks, for example, you're talking more or less 2 months there. People are still going to have to be buying their food and securing accommodation in this time. What advice or support are you offering to them over this waiting period? Well,
one of the important things, Rob, I need to emphasise is one of the reasons for the waiting time is a lot of the people who've contacted us aren't even in the UK. And that's the issue. The vast majority of people who were in the UK at the time prior to the border closure got back onto the island. There's very few that are actually still sat within the UK. So we've got to get those people back into the UK first before we can repatriate them to the island. And that's going to be the difficulty, because there are people in very far-flung corners of the earth who are trying to get back. So that is one of the reasons it's got to be spread out as well, because those people have got to get back to the UK. What I would say to people is those that are in the UK, obviously we will look to deal with first. Those who are further afield, they need to follow the Foreign and Commonwealth Office advice that where there's domestic flights, they should try their best to get back to the UK under their own steam. Where there isn't, they should contact the Foreign and Commonwealth Office about the repatriation programme to see if that can be of assistance. But obviously the people who we will be bringing back first are the people who are already in the UK from pure logistical reasons.
Yeah, thank you.
Okay, next up we have Paul, MTTV.
Hello, David. Can you explain why 9 more days before you can bring this in? I mean, I understand there's got to be a little bit of paperwork, but you could bring in a key worker tomorrow. And on that, some people are probably sitting in the UK, probably sitting at Haitian, dying to get a boat home. Is there no way that can be speeded up? And why have you come up with this 9 days as the marker?
Because it's got to be done in a medically controlled way. It's nothing to do with paperwork, Paul. It's about making sure that we bring people back in a controlled health way. And the clinicians want to make sure that the process of how we deal with people once they are on Ireland, in terms of the secure accommodation, how they will manage people in that accommodation, how they will manage people on the boat as well, because you could have people in the asymptomatic stage, to ensure that that is medically sound. So unfortunately, that is going to take time. Perfectly honest, I think the very fact we're talking about doing this in 9 days' time is actually quite quick. Our clinicians have been working with us since the border closure, but it still takes time to put all these processes in place. We are not simply going to rush this for the sake of it. We need to ensure for the people already on Ireland that anyone we are bringing back in is managed in a proper clinical process. And that is what has been driving the decisions on this the whole way along. And being quite blunt, it is what we will continue to drive the decisions on this going forward.
They've got to prove that they are free of the virus, and that means presumably getting a test. They have to do that on their own fruition, somehow get a private test taken, or is there some mechanism that you'll be setting up that every person who wants to return will get that test in the United Kingdom?
There will be port testing for the individuals prior to them coming back, so they will be tested
in the UK
at
or
the
Isle of
port.
Man?
In the UK. They will be tested in the ports in the UK at Heysham to make sure that they are symptom free. Now, obviously, that still doesn't pick up asymptomatic patients because it's a temperature check, which we've had long debates about before. But what it does mean is we know that at the very least, people will be asymptomatic, not symptomatic. If people are symptomatic, they cannot travel back. It is as simple as that. If they are showing symptoms, then they will not be allowed back into the island. Only those that are not showing symptoms will be.
And they'll all have masks on, will they? Because this is now getting to the point where everyone's going to have to wear masks, I think.
Well, no, not according to World Health Organisation advice, Paul. We follow World Health Organisation advice in relation to masks, and that is still quite clear that if you are a healthy individual, there is no reason to be wearing mask unless you are dealing with someone who has a COVID diagnosis. In fact, actually, there's been various studies that have actually shown wearing masks can actually be counterproductive, because the virus can embed itself on the fabric of masks, and unless you are continuously changing that mask or you are removing it in a controlled fashion, which means you don't touch the fabric of the mask, you can actually spread the virus from the mask that you're wearing. So there's been various studies done around the world. I know there's certain countries that are now offering different advice, but the advice here in the Isle of Man is still that of the World Health Organisation. Okay, next up, Josh, ITV.
Thank you, Minister. Will bringing back the Manx residents scattered around the world change the provisional 21-day period that was originally put in place for the border closure? And will the border now remain closed beyond that 21-day period? And how has that timescale now changed?
So the length of time of the border period, as we said, it will be reviewed. We are receiving clinical advice all the time, and decisions will have to be made around that. At the moment, I don't have any announcement to make to date in relation to that. But what I can say is bringing the residents back will not be a decision as to anything that affects the border closure. The reason being we're doing this in a clinically controlled way. And that is exactly why we need to do it in a clinically controlled way, so that it doesn't have any impact on any of the decisions that we have made. There will be, there will be an assessment of the border closure when there's an appropriate time, and an announcement will be forthcoming. But I think personally what's important is that the residents that are coming back are managed in a very controlled way to ensure they can return home, and we've been working very hard with our clinicians to do that, but that will not impact on any other decisions taken by government. The only impact would be if we felt that was threatening what we're doing on Ireland, as I made absolutely clear in the statement there, then any repatriation would cease.
And do we know where this place of accommodation is going to be? And will it be managed, and who's it going to be managed by?
So the accommodation will be managed. There are 2 accommodation blocks that have currently been identified. I'm not at the point where I'm ready to announce that yet, because again, we need to speak to our clinicians and make sure that those particular areas are manageable. There will be security provided for the accommodation. As I say, people will be exceptionally limited. They can't come and go. It is a proper a proper isolation facility for them, and they will have to abide by the rules and regulations within that facility for the 14 days that they are there.
Thank you.
Okay, next up I have Chris from Energy.
Good afternoon, Mr. Ashford. Another weekend where islanders were urged to stay indoors and respect the government guidelines. My question is, how does the government plan to integrate people back to work whenever that time comes? Will it be done in phases, or is everyone expected to go back to normal overnight?
It will have to be a phased approach. When you're exiting anything such as this, which is a worldwide pandemic, you are never going to be able to turn it on and off like a light switch. You're never going to get to the point where you can just flick the switch and say, yesterday was lockdown, today is absolutely normal. It will need to be a phased approach. And again, we are speaking to our clinical body about how we would manage that phased approach and what would be appropriate in each phase. Again, we're not at that stage yet of being able to announce anything around that, but it is talks that are ongoing about how we would stage a phased exit. But it's not something you could just flick the switch on and off on.
And how much notice will be given to the workers and also the employers as to when these workers will be phased back in?
Well, obviously, we would hope to give as much notice as possible. But again, that has to be done based on clinical advice. All the decisions we are making in government are based on the advice of our clinicians, quite rightly. So we would want to speak about the various risks in different sectors, and that would dictate as and when which sectors can be turned back on based on that medical advice. So it would be done on a risk approach basis.
Thank you. And I've seen myself police officers out on patrol that haven't been standing 2 meters apart from each other. Are police officers and emergency services personnel in general exempt from the social distancing rules, or are they too expected to adhere to them? And if so, how do you propose to enforce that?
Well, obviously, I would hope the police would respect the social distancing. With some of the tasks they will go undertaking, let's be perfectly honest, it's very hard for them to manage to do social distancing, particularly when out on patrol themselves, and obviously when they may be in a squad car together as well. That's just a practicality of the job, unfortunately. But where practically possible, we would hope that the police and other people who are still at work would observe those social distancing rules. Okay, next up I have Alex, BBC.
Hello, Minister. Apologies, this question really should be for the Chief Minister, but in his absence, I hope you can give us some direction on it. You've admitted again today that there are some residents who are stuck away through no fault of their own. We know that. They've been unable to get back to the UK up until this point, and perhaps up till a point in the future. There's been some really emotive and strong language used around this issue, not least in Tynwald last week, when it was suggested that letting these residents in could lead to the bodies piling up. Will the Council of Ministers offer anything in the way of an apology for the language used here, which has led to some quite vitriolic comments directed at these people who've been stuck away through what you say is no fault of their own?
Well, to be honest, Alex, I think there's been emotive language on both sides, to be perfectly frank as well. There's been emotive language around residents being abandoned abroad, which is clearly not the case. What we have had to do is we have had to follow clinical advice and ensure that we do what was best for the island. We received medical and clinical advice that a border closure was the best way forward to manage that. We did that. We realised that caused problems for people who were already abroad, and it has left some people in a situation they obviously wouldn't want to find themselves in. I've been speaking to a lady who's a constituent of mine who's stuck out in Australia and is trying to get back to the UK. But the important thing is that we do what is best for the island as a whole. We have taken on board the clinical advice, and the clinical advice was absolutely clear that if we were to control the virus and we were not going to end up with the spread in the way it has gone in the UK, then we needed to action a border closure and an immediate border closure at that point. Council of Ministers listened to our clinicians. We have done that, and the clinicians themselves have said it has helped manage the curve, that we are already seeing the effects of that, slowly but surely. Still too early to say overall where we are in the curve, but it has had an impact, and it was important that we did that. So myself, I think I mentioned it about 3 or 4 times. I put the message out there before we'd even considered a border closure, saying that if you were a Manx resident, get yourself home. If you wanted to be home, get home, because things were moving exceptionally fast. The Chief Minister, I think, stated it on about 7 occasions. So the message was clearly out there that anyone who wanted to be back on the island, they should have tried to get back. Now, with the best will in the world, we know that due to lockdowns around the world, that certain people couldn't manage that. But that is why now we are looking at doing this in a clinically managed way. And that is why it's got to be done in a clinically managed way, because if it's not, then that's when we will have a problem and we will end up with cases emerging in the community in the Isle of Man. We take the advice of our clinicians and we manage it in a clinical way.
Thank you. And just to move on there, there was talk last week, unfounded as you said, about a backup healthcare facility. Now we're seeing plans moving at a rate of knots really in the UK with the Excel Centre, the GMEX in Manchester. Several sports centres are also being reported in the north of England as being repurposed. Any movements on similar plans in the Isle of Man?
No, as I stated at the press conference on Thursday, our plans evolve around expansion up at Nobles. We know roughly how many extra beds we think we might need. We can do that via an extension around Newlands and areas up there at the hospital, and that's what we're working on. Because we followed the clinical advice which I've just referred to, and we can implement a border closure, being an island in a way the UK can't really manage, we have been able to potentially head off the more extreme bits of our curve, we hope, once we get the final figures in over the next couple of weeks. But we've found it a lot easier to manage than larger jurisdictions in that regard. So we don't need to go down the drastic measure of actually converting, say, the National Sports Centre. As I said, the NSC is remaining as the NSC. The sports hall, while it's decommissioned, will be used for storage of some stuff we can't store up at Nobles because we haven't got enough space. But other than that, there is no plans to convert anything whatsoever. Because we don't at that stage require it, and hopefully the actions we have taken on our clinicians' advice, which we took in exceptionally quick circumstances, have actually allowed us not to go down the route that the UK has had to. And also one of the other critical things is, of course, unlike the UK, we've carried on with community testing, so we have been able to keep track of the virus as much as we can in the community and its spread, whereas the UK stopped community testing, so basically lost track of the spread in the community.
Thank you, Minister.
Okay, and then last but certainly not least, I have Jess from Isle of Man Newspapers.
Hello, Mr. Ashford. So I'm wondering, how is the health department keeping up to date with any possible vaccines against coronavirus to ensure that the island is able to get the vaccine quickly and as a priority?
Well, Jess, we look at what's going on around the world, but with vaccination, I've got to be brutally honest, it's going to be potentially a long, long way off. Vaccination is certainly highly unlikely to be around by the end of this year. The way that vaccines are developed and the way they're tested, even in the US, where I know with one particular test of a vaccine, they've skipped the animal trials to go straight to human trials, that is still normally about an 18-month lead-in period. So I'm afraid the vaccines are not the great panacea that I think some people hope they will be. It's going to be still probably about 18 months at best before any form of reliable vaccine will be on the market.
And how is the department keeping up to date with that exactly? What kind of communication is going on there?
Well, we feed into Public Health England. Our officials speak to Public Health England officials all the time, but also we do in our Public Health Department look further afield at what's developing in other public health. We feed in with the World Health Organization as well, which is a very good bank of data knowledge as to what's happening around the world, and we are able to feed in and see what's happening there. But like I say, I really do need to emphasize that people shouldn't put their hopes on vaccination, because any form of vaccine will be at least a good 18 months away, if not longer.
Thank you. And for my second question, it's for the animal lovers amongst us. So we've seen reports about a tiger at a USA zoo, which has caught COVID-19 from a zookeeper. What are the concerns about livestock and pets here?
So we follow, again, the World Health Organization advice, although it has been shown it can cross the species barrier, and the tiger was one case in point, which was announced yesterday. It is generally still rare, so the risk of it passing to other forms of animals, particularly household pets, is still seen as quite low down down the chances of it actually happening. But so our advice remains exactly the same, that the risk is relatively low and there's not any major precautions that people need to take at this time.
Thank you.
Okay, well, thank you very much, everyone, and I'll see you again tomorrow's press conference. Thank you.
The global pandemic of coronavirus is without doubt the gravest threat we have faced both as an island and as a nation.
We are working hard to help our island as a community, but we are asking you to help us to help you.
For your island, for your community, stay at home.
For your island, for your community, stay at home.
For your island, for your community, stay at home.
Stay at home.
Stay at home. Stay at home.
Please stay at home.
Protect your community. Stay at home.
Stay at home.
Stay at home.
Stay at home. Please stay at home.
Stay at home. For your island, for your community, stay at home.